In 2026, Medicare will hand you a benefit credit worth up to $2,100 a year. And it will do it without sending you a single letter, without updating your online account, and without telling your doctor's office to mention it at your next visit. That $2,100 is real. It is sitting inside a program that most people on Medicare have never heard of, and it can go directly toward lowering what you pay out of pocket for preventive services, dental screenings, hearing exams, vision tests, and even certain over-the-counter health products. If you are living on a Social Security check between $1,400 and $2,500 a month, that is not a small number. That is almost 2 full monthly checks. The reason you have not heard about it is not because it is new. It is because the Centers for Medicare and Medicaid Services restructured how Medicare Advantage supplemental benefits are reported, and the change was published in a Federal Register update that ran to 412 pages. The benefit itself is buried on page 271. No summary was mailed, no insert was added to your Medicare and You handbook. The standard notice most enrollees received during open enrollment said nothing about it. By the end of this video, you will know the exact name of the benefit category, the plan types that carry it, the enrollment window that is still open for certain qualifying individuals in March 2026, and the 3-sentence script you can read to your plan's member services line to find out within 5 minutes whether you are already eligible and simply never claimed it. My name is David Chen. I spent 27 years as a senior field agent with the Internal Revenue Service. I have seen every version of the same trick the federal government plays on people who follow the rules. The trick is not illegal. It is not a conspiracy. It is simpler than that. The trick is complexity. When you make a program complicated enough and bury the instructions deep enough, most people never find what they are entitled to. The money stays in the system. The budget line looks good, and millions of Americans go without. Let me explain exactly what this benefit is and where it has been hiding. Starting in 2024, the Centers for Medicare and Medicaid Services expanded what are called Special Supplemental Benefits for the Chronically Ill, known by the abbreviation SSBCI. This was not a brand new invention. The framework was created by the Bipartisan Budget Act of 2018. But for years, the benefits were narrow, hard to access, and poorly communicated. In 2024 and continuing into 2025 and now 2026, CMS gave Medicare Advantage plans significantly more flexibility to offer supplemental benefits that go well beyond traditional medical coverage. These include meal delivery after a hospital stay, transportation to medical appointments, pest control services for people with asthma, air conditioners for people with cardiovascular disease, and a wide range of over-the-counter health products. The annual value of these combined benefits when a person qualifies and actually uses them can reach $2,100 or more depending on the plan. Now here is what was hidden. These benefits are not part of original Medicare. They exist only inside Medicare Advantage plans. And even within Medicare Advantage, they vary from plan to plan, county to county, and year to year. CMS does not require plans to advertise these benefits prominently. There is no checkbox on the Medicare website that says, "Show me plans with SSBCI benefits." The plan comparison tool on Medicare.gov lists some supplemental benefits, but it does not separate the SSBCI benefits from the standard supplemental benefits, so they get blended into a general list that most people skim past. Think of it like a grocery store that puts the clearance items on a bottom shelf behind a pillar in an aisle with no sign. The items are technically available to every customer, but the store knows that 90% of shoppers will never see them. The CMS regulatory guidance for 2026 Medicare Advantage plans is contained in the annual call letter and the final rate announcement, published in April of the prior year. The specific language authorizing expanded SSBCI benefits is found in Chapter 16B of the Medicare Managed Care Manual. If you try to read that chapter, you will find it runs over 60 pages and is written in regulatory language that assumes the reader is a plan compliance officer, not a 70-year-old retiree trying to figure out whether her plan covers a grab bar installation in her bathroom. That is not an accident. The system is designed for intermediaries. It is designed for insurance companies, for benefits consultants, for enrollment brokers. It is not designed for you. And the result is predictable. According to the Medicare Payment Advisory Commission, also known as MedPAC, in their March 2025 report to Congress, a significant majority of Medicare Advantage enrollees who qualify for supplemental benefits beyond basic medical coverage never use them. The estimated total value of unclaimed supplemental benefits across all Medicare Advantage enrollees nationally exceeds $14 billion per year. That is not a typo. $14 billion in benefits that were approved, budgeted, and available, and went unclaimed because the people who earned them did not know they existed. Let me tell you about 3 people I have spoken with in the last year. Their names have been changed, but the numbers are real. The first is a woman I will call Dorothy. She is 71 years old and lives in rural Ohio. Dorothy has type 2 diabetes and mild chronic kidney disease. She has been on a Medicare Advantage plan through a major national insurer for 4 years. Her monthly Social Security check is $1,612. Her Part B premium of $185 is deducted before she ever sees it. So her deposit is $1,427. Dorothy pays for her own groceries, her own medications, and her own transportation to a clinic that is 22 miles from her home. In 2025, Dorothy spent over $900 out of pocket on gas and rideshare services getting to and from medical appointments. Her Medicare Advantage plan included a transportation benefit that would have covered up to 48 one-way trips per year at no cost. She did not know. The benefit was listed on page 19 of her Evidence of Coverage document, a document that was mailed to her in September and runs 147 pages. Dorothy told me she thought it was junk mail and almost threw it away. When we called her plan together in November, the representative confirmed the transportation benefit, the over-the-counter health product allowance of $60 per quarter, and a meal delivery benefit of 14 meals following any inpatient hospital stay. The combined value of what Dorothy did not use in 2025 was approximately $1,800. The second person is a man I will call Raymond. Raymond is 68 and lives in Tucson, Arizona. He has chronic obstructive pulmonary disease and congestive heart failure. Raymond is on a different Medicare Advantage plan. His Social Security check is $1,904 per month. Raymond qualifies for SSBCI benefits specifically because he meets the chronic illness threshold, which under CMS guidelines requires at least one qualifying chronic condition that a licensed provider certifies is expected to last at least 12 months. Raymond's plan offers an air purification system benefit, a home modification benefit for fall prevention, and a quarterly allowance for over-the-counter respiratory products such as humidifiers and replacement filters. In 2025, Raymond spent approximately $700 of his own money on items his plan would have provided at no charge. When I asked Raymond whether his doctor ever mentioned these benefits, he said no. When I asked whether his plan ever called him to explain what he qualified for, he said no. When I asked whether the benefits were listed in his plan materials, he said he wasn't sure because he could not read the small print anymore, and his wife had passed 2 years ago, and she was the one who handled the paperwork. The third person is a woman I will call Anita. She is 63 years old, lives in Memphis, Tennessee, and receives Social Security disability insurance. Her monthly SSDI payment is $1,408. Anita has been on Medicare for 2 years, which she became eligible for after her 24-month waiting period on SSDI. She enrolled in a Medicare Advantage plan during her initial enrollment period. Anita has rheumatoid arthritis and major depressive disorder. Her plan includes a supplemental benefit for non-medical in-home support, which covers up to 16 hours per month of help with light housekeeping, laundry, and grocery preparation. That benefit alone is valued at approximately $2,100 annually, based on prevailing home care rates in Shelby County. Anita has never used a single hour. She did not know it existed until a caseworker at a local nonprofit mentioned it during an unrelated visit about utility assistance. That caseworker told Anita something that stuck with me. She said most of the people I help have benefits they have already paid for, that they will never use because nobody in the system is paid to tell them. Now I want you to ask yourself one question. Do you know what supplemental benefits are included in your current Medicare Advantage plan? And have you used any of them in the last 12 months? If you cannot answer that question with a specific dollar amount and a specific benefit name, then you are almost certainly leaving money on the table, not because you're careless, because the system made it that way. Let me now show you where this information has been buried and exactly how to dig it out. The first place to look is a document called the Evidence of Coverage. Every Medicare Advantage plan is required by CMS to issue the document annually. It is mailed to enrolled members before the start of each plan year, typically in September or October. The 2026 Evidence of Coverage for your plan is the controlling legal document for what your plan covers this year. It is usually between 100 and 150 pages long. The supplemental benefits section is typically in Chapter 4, but in some plans it is in a separate addendum. You are looking for a section labeled Supplemental Benefits or Special Supplemental Benefits for the Chronically Ill. If your plan offers SSBCI benefits, they will be listed there, but they may be conditional on your provider submitting a certification that you have a qualifying chronic condition. That means even if the benefit exists in your plan, it is not automatically active. You or your doctor must trigger it. The second place is Medicare.gov. Go to the Plan Finder tool, enter your zip code, look at the plans available in your area. When you click on a plan's details, there is a section that lists supplemental benefits. Read every line. Do not skim. The SSBCI benefits are not flagged or highlighted differently from standard supplemental benefits. You have to know what you are looking for. The third place is the CMS Medicare Managed Care Manual, Chapter 16B. This is the regulatory source document that defines what supplemental benefits plans are allowed to offer. It is publicly available on the CMS website. You do not need to read the whole chapter. Search the document for the phrase Special Supplemental Benefits for the Chronically Ill, and you will find the eligibility criteria, the list of qualifying conditions, and the categories of benefits that plans may offer. This is not easy reading, but it is the proof that what I am telling you is real. It is codified in federal regulation, and you can see it yourself. The fourth place, and this is critical for anyone who enrolled in a Medicare Advantage plan during the Medicare Advantage open enrollment period, which ran from January 1st through March 31st of 2026, is your plan's member services phone number. That number is on the back of your Medicare Advantage card. You can call that number right now and say the following 3 sentences. I'm calling to ask about supplemental benefits included in my plan for 2026. Specifically, I want to know whether my plan includes any special supplemental benefits for the chronically ill, and if so, what conditions I need to meet to activate them. Please also tell me about any over-the-counter allowance, transportation benefit, meal benefit, or home modification benefit included in my coverage. That is all you have to say. The representative is required to answer. If they cannot, ask to be transferred to the Benefits Coordination Department. Document the name of the representative and the date and time of the call. Now here is the part that most people miss entirely. If you are currently enrolled in Original Medicare and do not have a Medicare Advantage plan, you are not eligible for SSBCI benefits. These are Medicare Advantage specific. However, you may be eligible to switch to a Medicare Advantage plan during the Medicare Advantage open enrollment period, which, as I just mentioned, runs from January 1st through March 31st. If you're hearing this in March of 2026, that window is still open. You can switch from Original Medicare to a Medicare Advantage plan, or switch from one Medicare Advantage plan to another during this period. If you switch, your new plan takes effect the first day of the month after the plan receives your enrollment. This means if you enroll in a new Medicare Advantage plan in March, your coverage would begin April 1st, 2026. You would then have access to whatever supplemental benefits that new plan offers for the remainder of the plan year. I want to be very clear about something. I am not telling you to switch plans. I am telling you that a switching window exists right now and that most people do not know what benefits they are comparing when they choose a plan. They look at premiums, they look at co-pays, they look at whether the doctor is in network. Almost nobody compares the supplemental benefit packages because nobody told them those benefits existed or that they could be worth over $2,000 a year. Let me also address something that comes up in almost every conversation I have with retirees about Medicare Advantage. People worry about scams. They should. The number of fraudulent Medicare Advantage marketing calls has exploded in the last 3 years. In 2025, the Federal Trade Commission and CMS jointly issued warnings about unauthorized agents enrolling seniors in plans without their consent. If anyone calls you and pressures you to switch plans, hang up. Do not give your Medicare number over the phone to anyone who calls you. The only safe way to evaluate your options is to go directly to Medicare.gov, call 1-800-MEDICARE, or contact your state health insurance assistance program, known as SHIP. Every state has a SHIP office and the counselors are trained, certified, and free. They will sit with you and go through every plan available in your zip code, including the supplemental benefits. Now let me tell you what to do today. Not tomorrow, not next week, today. First, if you are in a Medicare Advantage plan, pull out your evidence of coverage document. If you cannot find it, call the number on the back of your card and ask for a copy to be mailed. Second, look for supplemental benefits. Write down every benefit listed. Third, call your plan and ask specifically about SSBCI benefits. Fourth, if you have a chronic condition, ask your primary care provider whether they can submit the chronic condition certification required to activate those benefits. Fifth, if you are in original Medicare and want to explore whether a Medicare Advantage plan with SSBCI benefits would be better for your situation, call SHIP or go to Medicare.gov before March 31st. That is the last day of the Medicare Advantage open enrollment period. I spent 27 years inside the federal system. The one thing I can tell you with certainty is that no one inside that system is assigned the job of making sure you know what you are entitled to. The IRS does not call you when you miss a deduction. The Social Security Administration does not call you when you file at the wrong age. And CMS does not call you when your Medicare Advantage plan includes a $2,000 benefit you have never touched. The information is public. It is legal. It is verified. But it is buried in documents that were never designed for you to read. That is why I do this. Not because I'm angry at the system. I spent most of my career as part of it. I do this because I sat in a cubicle for 27 years and watched the distance between what people are owed and what people actually receive grow wider every single year. That distance is not caused by fraud most of the time. It is caused by complexity. And complexity is a choice. The people who designed these programs could have made them simple. They chose not to. So the last thing I will say to you is this. You already paid for these benefits. They are already in your plan. The money is already allocated. The only thing standing between you and that $2,100 is a phone call, a question, and the willingness to believe that the system owes you more than it volunteered to give you. Make the call. Ask the question. And do not wait until open enrollment comes around again in October to start paying attention to what your plan actually covers. By then, another year of unclaimed benefits will have disappeared. The number for Medicare is 1-800-MEDICARE. The website is Medicare.gov. Your SHIP counselor is free and can be found by searching SHIP Medicare Counseling followed by your state name. Everything I have described in this video is documented in the CMS Medicare Managed Care Manual, Chapter 16B, and in the Evidence of Coverage document issued by your plan for the 2026 plan year. None of this is hidden from you by law. It is hidden from you by design. And now you know exactly where to look.